Thank you very much. Very exciting to see lots of people here today. I hope you're enjoying the conference. I want to thank the organizers of the conference very much for having this topic, the importance of a physical examination for incoming shelter animals. So this is just a nice quote to start us off today, that you'll miss far more by not looking than by not knowing. And this is an LVT track. I tried to design it for anybody who really wants to come and listen about the importance of a physical examination upon intake. But there may be many different types of people who are doing this for animals as they come into our shelters. And the big takeaway message here is that we don't have to worry or belabor the point so much about if we see something that's abnormal, is what's the cause of it and how are we going to treat it. The important point here is just to recognize it, to have a system in place so that you can look at the animal completely from head to tail. And also, once you recognize any abnormalities, to write them down so that it can be taken care of. You can gain medical assistance for that animal from a veterinarian if it needs to be treated, if it needs to be triaged further. So just really important that we know what to look for, what the differences are between normal and abnormal, and make a notation of anything that you find in that animal's record. So we're going to do some interaction. Some people like it, some people don't. Hopefully we're filled with an audience who likes interaction. We are going to talk today about the examination findings themselves, but we're also going to talk about the very important timing of that examination, that we want to do it for animals at the time of intake. So think for just a second about why this is both valuable and necessary to be doing the exam at the time of intake. And we're going to hear some of your ideas, and then we'll go through and see some of the things that I came up with. So is anybody willing to start us off? Go ahead. Great. So the comment was to protect the rest of the population from the spread of disease. Because we, as shelters, we constantly have an influx of animals, some of them with an unknown history, some of them who currently are incubating disease, some of them who are showing signs of clinical disease. We want to protect our population that we currently have, and even the next animal that's following that animal. Where are they going to go to keep everybody as healthy as possible? Anything else? Yes? Great. So the comment was to assess the severity of a condition that the owner has identified. If this is an owner surrender and they say the cat has bladder stones, we want to see, is this cat blocked? Is this an emergency situation that we need to deal with right away? And then we can best be able to provide care for that animal. I saw another hand. Great comment. So the comment was to facilitate a decreased length of stay for the animal population that we have. And we're going to see how we can do that. Anything else? Okay, so these are some of the things I came up with. If the animal is an owner surrender, we can review the animal's history, if it's known. Does the animal have any medical or behavioral concerns? Are they on any medication that we need to continue while the animal's in the shelter? If it's a stray, is the finder possibly interested in adopting him? And also the reason for the surrender. The reason for the surrender may have nothing to do with the problem that the animal may have, be it medical or behavioral. Maybe the owner can't afford care for this animal anymore. Maybe they're moving. Maybe they have an allergic child. Whatever the situation may be, we want to make sure that we're gaining all that information and processing it all. The other reason at the time of intake, very important to search for a microchip or any identifying features to help speed the reclaim of this animal. Pretty sad if you find out an animal has a microchip 2 weeks after he's been with you, and we could have found that upon intake, and he could have left either that day or the next day. We're going to talk a little bit more about the challenges of microchip scanning later. Does the animal need to have anything scheduled? And these aren't emergency situations that need to be dealt with immediately, but we need to schedule spay-neuter for some animals who come into us intact. We need to schedule a behavior assessment, or in some cases even something like a grooming to make that animal more comfortable. And I added this later after I thought about it to save time and money. And money, obviously, there was a situation we were dealing with a shelter who said that some animals could linger within their intake room for up to 3 days before they gave that animal a physical examination and before they vaccinated them. And there were lots of reasons why, but ultimately the recommendation was if you're going to spend that amount of time, be whatever, 10 minutes, 5 minutes on that animal, it is way better to do that at the time of intake than spending that same amount of time 3 days later. So we helped that organization to figure out how they could make that happen. And that actually, if you have an animal coming in who's an owner surrender, who could easily be placed on the adoption floor that day or the next day, you're saving your organization all those resources that you'd be spending on caring for that animal while it was lingering within that intake system. And the other big thing with time, I thought of the example, my history is in spay-neuter a lot, and there's been cases where we would put an animal who was not identified as male, female, or neutered or already spayed on the table, and that wasted a lot of our time. If that would have been caught and identified at the time of intake, we wouldn't have anesthetized that animal, it wouldn't have gone through that system, and we wouldn't have wasted maybe a half an hour or 45 minutes on that one particular animal. So other reasons come from the Guidelines for Standards of Care in Animal Shelters, and this was published in 2010. And I'm just going to read a couple of more reasons why this is so valuable and necessary. Each animal's health status should be evaluated and monitored beginning at intake and regularly thereafter. This allows any problems or changes that develop during the animal stay to be recognized and distinguished from pre-existing conditions and addressed. So if this animal comes in and had you didn't mark any abnormalities for skin, and then a week, 10 days later, you see that he's having an allergic skin reaction to something, you know that that's a condition that has developed within the shelter as opposed to something that he came in with. Each animal should receive a health evaluation at intake to check for signs of infectious disease and/or problems that require immediate attention, and intake evaluations should be documented in the medical record. Starting at the time of intake and continuing throughout their stay, healthy animals should not be housed or handled with animals who have signs of illness. And just so you know, there's lots of references in this presentation, lots of places where you can gain further information. And I submitted the slides to Erin, so they should be in the process where you can access them. History should be used to alert staff to the presence of potential problems such as aggression or anxiety, and to inform staff of any individual needs that that animal has so that we can properly care for them while they're with us. And also at the time of intake, it gives us the opportunity, we're already looking at this animal, it gives us the opportunity to administer vaccinations, dewormings, flea and tick control, and perform any diagnostic testing according to your shelter's protocols. Also a very good time to take a picture of the animal for its records and for any lost and found postings, and also to place an identifying collar on the animal. And this is one example of resources. We're really not going to go into establishing protocols for vaccinations, dewormings, flea and tick control, but all of that information can be obtained from the resources that are listed, the 2013 AAFP Feline Vaccination Advisory Panel report, and similarly from AHA, a Canine Vaccination Guideline report, and also the Companion Animal Parasite Council. And the bottom line here is that, and that goes to the point that was made in the back, we want to put this animal on a pathway to receive optimal care while they're in the shelter, to decrease the time, the overall amount of time that they're spent with us, and maximize their chance for live release. And this is my legal disclaimer. It seems that anytime we give presentations dealing with shelter medicine issues, we always have to have a legal disclaimer of some sort. Check your state's Veterinary Practice Act to determine who is allowed to perform intake examinations. In many cases, only licensed veterinarians are allowed to diagnose animal conditions and devise treatment plans. But that's okay, because the goal of an intake evaluation is not diagnosis of disease. The goal is simply recognition of conditions that should be further assessed. So, before we dive into how to perform physical exams, we want to think about safety first, and we want to decrease stress. And decreasing stress for both the animal as well as the staff members, volunteers, anybody who's dealing with these patients. We want to make sure that everybody's having a good experience. And that includes appropriate and humane handling for cats and dogs in a safe and controlled environment. And we want to make sure that we have, it doesn't necessarily have to be a room, although a room is nice, an intake room, but at least an area where we have everything in one place, that we're not going to pull the animal out and then have to go looking for things, because that's only going to increase your stress and obviously the stress of the animal. We also want to minimize external stimuli, and we can't work in a dark environment, but we could have the lights lowered, we could have a very quiet area or room, and also to decrease olfactory and visual stimulation. If we're going to pull a cat out to give an intake exam, obviously we don't want to parade barking dogs by it, because that's going to increase their stress level. And as needed, if you have an animal that's particularly fractious, under the direct supervision of the veterinarian, using appropriate drugs when needed. Hopefully, somebody brought this up to me earlier today. This is obviously for the majority of our patients that come to us. There's going to be animals who come to us upon intake that we can't handle, that are so fractious that those guys do need a cool down time in order for us to be able to handle them at a later date. So everything we discussed today is the bell curve, the majority of patients, recognizing that there are those outliers that we need to handle under special circumstances. And really good webinars for your future reference to learn about feline communication, canine body language, are offered by ASPCA Pro. And here they're great webinars that show you what the cats are communicating, how the dogs are telling you what they mean in their own body language. And very good idea for anybody who's doing intake exams to understand that language. And then as a correlate to that, after you learn about the body language, is humane feline handling and defensive dog handling, and that's offered by ASPCA Pro as well. And this tells you about how to pick up cats, place them in their crates or transfer cages, and also how to effectively and humanely deal with equipment that we have to manage fractious animals for both cats and dogs. Another great resource is offered by Dr. Sophia Yin, and she has the websites listed there. There's books and DVDs, but there's a lot of little short snippet clips that are very useful about how to use a towel properly to handle fractious cats, and a lot of other great resources there. So ideally, we would like for our staff to be trained by a veterinarian in what to look for upon the physical examination or animal evaluation. We want to develop a systematic approach for checking the whole animal and follow that same routine every time. But the caveat here is, and I find this when I perform exams on animals too, somebody will bring you an animal and say, they're limping, they're lame. And my first inclination is to look for lameness, obviously. But what I find is more beneficial is to look over that animal, as I do with everybody, from head to tail, and then focus on the problem area. It makes me not miss other things that might be going on with that animal, that are related or even unrelated to the lameness. It'd be great if you could work in a team so that one person could be handling the animal and getting supplies, and also don't spread disease. There's lots of other presentations going on about disease management, but we want to be cognizant of wearing gloves, washing our hands, washing the table in between every patient, and really, really important, watching how we're carrying the animal so that we're not constantly infecting, passing on germs, having our scrub tops be a foam wipe. And if necessary, changing your scrub tops or wearing personal protective equipment, gowns and things like that, so we're not passing germs from one animal to the next. And like we discussed before, if it is determined to be unsafe to perform any or all parts of the exam, give the animal a cool down period, see if we can work with them later. So we're going to dive into the animal evaluation part. First thing, signalment. And here, if the animal has a name, note that. What their species is, breed, mix, color, and age and sexual status we're going to talk more about. But sexual status, obviously our choices here, male or female, spayed or neutered. So age. Age is really important to know, especially with younger animals, so that we can put them on a proper vaccination schedule, so that we know if they're gaining weight appropriately as they progress. Also to know when we can spay and neuter them. So there's lots of resources out there that help us estimate age by teeth. And here's just one resource by HSUS that shows week by week what their development of their teeth look like. And here's a great pictorial resource for kittens that shows how their incisors develop, how their adult incisors come in at 3 months, 4 months, 5 months, 6 months. So those would be great resources to hang up on the wall, keep in your SOP manual for training of intake staff, so that everybody can accurately identify those age groups, and also so there's consistency between the people who are performing those intake exams. So sexual status. In dogs, pretty easy. In cats, sometimes that can be tricky. Here we have some diagrams. And again, you guys as LVTs may know this, but it might be useful for training purposes for other people. So, yes, I can walk. We have an unneutered male cat. So there's a larger distance between the anus and the prepuce, and that shows testicles because he's unneutered. A smaller distance between anus and prepuce in the females, and obviously the neutered cat, same distance, but no testicles. So in kittens, this can be even trickier. And here we have, and just because the parts are like micro-sized, here we have female kitten and male kitten who's obviously unneutered. And here we're going to refer to the Association of Shelter Veterinarians Veterinary Medical Care Guidelines for Spay-Neuter Programs. This was published in 2008. We're actually, the Association of Shelter Veterinarians is revising this document, and it is due to be published in early 2016. So for those of you who this has been helpful, and for those of you who would like to be introduced to the recommendations that are in this document, look for a revised copy in 2016. So this indicates that this is a recommendation that each spay-neuter program should choose a consistent means of identifying animals that have been neutered. And tattooing of the ventral abdominal skin is recommended for females, and obviously sterile instrumentation should be used to apply the tattoo regardless of the method chosen. So that just shows, after that heals, what it looks like. And wouldn't it be great if we were doing our intake exams and we thought, this cat might be spayed, and we shaved the abdomen and we saw that. That would save a lot of time, a lot of money, a lot of resources for your shelter to know that that animal is already spayed, we can put her up for adoption. So the point here is that so raise your hand if your shelter also performs spays and neuters for public animals or free-roaming cats. Great. Now keep your hand up. Do you guys, if you tattoo, keep your hand up. If you don't tattoo, bring your hand down. So everybody, it looks like almost everybody tattoos. And that's really, really impressive because we're putting these animals in the community. We're going to get a certain percentage of them back into our shelters. Maybe not our shelter, maybe somebody else's. But at least we're being proactive about allowing us to identify the spay-neuter status of these animals so that when they come into somebody else's shelter, it will be easy for them to identify. So the other thing is in free-roaming cats, unilateral ear tipping is recommended method for identifying cats that have been neutered. Removal of an ear tip represents the universally accepted international standard for identifying free-roaming cats. So again, if you have a free-roaming cat spay-neuter program, are you guys ear tipping? Show of hands. Terrific. And that also helps caregivers, obviously, because saves them time and money because they can recognize that as a sterilized animal from a distance. They know that they don't have to focus their efforts on trapping that one cat. So if we don't have an ear tip, if we don't have a nice tattoo, we have to start resorting to other things in female animals. We're looking for a spay scar, which can be tricky because if you find a scar on the ventral abdomen, it may be due to a previous C-section, maybe due to some sort of other abdominal surgery. So then we start looking for other signs. Does this animal have an enlarged vulva? Do they have mammary gland development? And we try to put all these pieces together to help us determine that animal's spay status. And after we determine that, we then look at all the reproductive parts to see if they look normal. Are both testicles descended into the scrotum? Do they have any testicular tumors? Look at the penis and prepuce for discharge and swelling. Look at the mammary glands. Is there any evidence of infection, swelling, heat? Any tumors? Are they lactating? Do they have abnormal discharge? Also look at the vulva, discharge, prolapsed vagina or uterus, and tumors. Obviously, that's a picture of a cat who is unilaterally cryptorchid. He only has one testicle descended into the scrotum, and that's a picture of a prolapsed vagina. All right, so we have a case study. You're a veterinary technician who's performing intake exams at an animal shelter. You're presented with a 2-year-old male cat with no palpable testicles. Is he already neutered or is he cryptorchid? So here's a handy-dandy trick you can do. If the cat allows, you can put him on his back, extend his legs towards his head, and try to extrude his little penis. And those are the options that we'll see. So can somebody tell us what we're seeing? So yes, the penis on the left side has penile barbs or spines, and the penis on the right side lacks those spines. So basically, the spines occur because of male sex hormones. They are present by 12 weeks, but they're very prominent by about 6 months. And the spines regress within about 6 weeks if the animal is neutered. So this is important because that cat who doesn't have any palpable testicles, rarely the cat could be bilaterally cryptorchid. That means that neither of the testicles have descended into the scrotum. And the spines would differentiate this situation from a neutered cat. But unfortunately, more common is that a cat could be unilaterally cryptorchid and may only have the scrotal testicle removed. The veterinarian saw one testicle, he removed one testicle. And the spines in that cat, we would see spines, and they would indicate the presence of a testicle in either the abdomen or the inguinal canal. And that's really important because maybe that cat's spraying urine. Maybe that cat's having some sort of issues that are related to his testosterone. And that might be a reason for surrender. That animal, yeah. Stericyl right now is only licensed for the use in dogs. I know that there's been some studies on cats. I don't know if the penile barbs regress, but in dogs at least, it takes down the testosterone level, but it doesn't eliminate it. So my guess would be that those penile barbs would exist in cats. But good question, and I'd like to know the answer to that. So anyway, in a case where you have no testicles and you still see penile barbs, that a cat is having some sort of issues, there's a good chance that there is a testicle either in the abdomen or in the inguinal canal. Okay, so moving along with our exam, we want to check for identification. Does the animal have tags? Is there any writing on the collar? And I put tattoos here as well, because the owner might have no idea why this animal has any of these markings, but they might write it on a lost and found report. And if you check lost and found reports and see an animal that has a matching tattoo, that might be a way to reclaim that animal. Okay, checking for identification includes scanning for a microchip. We want to make sure that this is done with a universal scanner using a slow, methodical fashion. Also use fresh batteries in the scanner so that it's up to its optimal use. And there's some diagrams on how to do this, taking the scanner from the neck area through the shoulders, down through the lumbar area, because unfortunately microchips can migrate. And if you don't find a chip that way, then it's recommended to use a zigzag pattern across the animal's back, as well as the left side of the animal and the right side of the animal. And also research has shown that you can increase the chance of actually finding a microchip by having multiple people do it at multiple times, so that you just increase the chances of finding it if it's there. Here's another handy-dandy resource for you. The American Animal Hospital Association has a nice microchip and scanning companion animals free 1-hour online course. And that might be nice for your volunteers, for your staff members who are in training, to take that to learn about the limitations of microchip scanning and how to overcome them at your shelter. That's a picture of my beloved dog, Pinky. And she's not happy that I woke her up to take that picture, but she's still smiling. So the AHA, American Animal Hospital Association, also has on their website a universal pet microchip lookup. And I got her microchip number out and put it in there just to see what information it would generate. And it was correct that she was microchipped in October of 2013 with 24-hour Pet Watch chip. And I also registered her with Found Animals Registry soon after that, 11 of 2013. So that just shows that if you get an animal and it has some sort of microchip number, you can go to that website, put it in, and it at least gives you the companies that microchip is associated with. Now, the problems, which I'm sure everybody has encountered, is that you call the company and that chip is not traceable back to an owner. And that's unfortunate. That needs more client education to make those things happen. And a lot of shelters are working on that, on registering microchips for people so that we can overcome some of those challenges. Okay, so continuing with our animal evaluation, we want to weigh the animal, and that's super important for everybody, but really important for cats. Cats may be, as their stay gets longer within our shelters, they may start losing weight because they're not eating. And so that would be a way to assess the animal's stress level, also to see if anything medically is going wrong with that animal as a reason for them not eating. Temperature, pulse, and respiration. I just looked up because I was curious about the ear thermometers in dogs, and there was one study that said that it did give a similar reading, and then a couple of studies that said that it did not, that using a rectal thermometer is still best. Recent history, and that might be something that the owner can tell us, but also if you have somebody surrendering an animal that they found yesterday, they may be able to tell us too if that animal's been coughing, sneezing, if they vomited in the car ride on the way over, if they had diarrhea. So always ask those questions to get any little piece of information that we can get. And here's a nice reference for us. This also could be posted in an SOP manual or in the intake area of temperature, pulse, and respiratory rate normals. And this is nice because it's listed for large dogs, medium dogs, small dogs, and even neonates, cats, because they'll all be a little bit different. So we want to assess this animal from a distance, see what their attitude is, see if they're being stressed out by the process. Also, is there any evidence of neurologic or musculoskeletal disease? An initial assessment of behavior, and that's not to replace a formal behavior evaluation, but it can give us clues as to how we're going to handle this animal, how we can best handle them, and also their general body condition. And here's a nice resource. It's the Purina Body Condition System scoring system, and it's both for cats and dogs. And this is instead of having your intake staff write overweight, underweight, this actually quantifies the process. So we can put a number to it. We can say this animal is underweight, and we're putting its body condition score for a cat as 2 out of 9. So again, that adds accuracy to the process and also consistency amongst the people who are performing intake exams. And then from here, we're going to work, we've assessed the animal's age and sexual status and gender and any identifying marks, any microchips. And from here on, we're going to work from the tip of the nose to the end of the tail. So we're looking at the animal's head and neck first. And we look at their face, any signs of fear, aggression, any asymmetry. Asymmetry could be due to muscle loss, could be due to neurologic problems. Also want to look at their eyes and their eyelids. Abnormality in size or position. And position could mean that the animal's eyes are actually sunken back. That might be due to dehydration. Or that the animal's eyes are protruding. That could be due to an abscess or a tooth problem. Any sort of discharge from their eyes could be a sign of infectious disease. Any anisocoria or change in pupil size from one eye to the next, and any evidence of tumors on the eyelids. We want to look at their nose and their nares. Do they have any sort of discharge? And to see the color of the discharge. It's generally thought that any sort of yellow, green, bloody, brown discharge is evidence of a secondary bacterial infection that is secondary to any viruses that have caused the initial infectious disease. We want to check their airflow to see if the left side is equal to the right side, see if they have any evidence of infectious disease that way. Also see if on the bridge of their nose, if they have any swelling, that could be due to a possible tumor. We also want to look at their ears. Carriage and position of their ears, discharge, odor, redness, swelling. Very important to especially in dogs, but it could be cats too, to see if they're shaking their head, if they're scratching. Could be evidence of infection or evidence of ear mites. If the animal will let you, assess their lips, open their mouth, assess their mucous membrane color, their capillary refill time. And here we're actually pushing against the gums, letting go, and seeing how long it takes for them to become their normal pink color. They can have some cardiac problems, respiratory problems that could lead to an increased capillary refill time. Does the animal have severe bad breath as evidence of dental disease? Can you see periodontal disease? Assess their level of tartar buildup. Do they have any tumors, broken, missing, or worn teeth? And here, head and neck, we're moving down to the neck. We want to assess their salivary glands, their peripheral lymph nodes to see if they're swollen. Also, pretty easy to judge in cats is their thyroid gland. Normally in a cat, you really shouldn't be able to feel their thyroid gland. But in cats who are hyperthyroid and they have an overgrowth of thyroid tissue, you can feel a blip or even a swelling of thyroid tissue. That would be an indication that that cat, judging on other clinical signs, may be hyperthyroid and may need to be tested for it. Also, is there any cough elicited upon palpation? A lot of times dogs who are brewing or have kennel cough, you can actually elicit a cough by palpating their trachea. And we mentioned prescapular lymph nodes and submandibular lymph nodes, but here's just the location of other peripheral lymph nodes that you can run your hand across and see if they're enlarged and make a notation of that. The animal might be fighting some sort of infectious disease, an abscess, making those lymph nodes be enlarged. So how many people are responsible in performing an intake exam? Are you expected to listen to heart and lungs? So, not that many, okay. It's difficult because it takes training and experience to get good at it, obviously. But I think even assistants, technicians, you can put the stethoscope on the heart, get used to listening to what normal sounds like. And then you'll be in a better position to judge heart murmurs or arrhythmias. And murmurs are abnormal sounds. Arrhythmias is an abnormal rhythm. And there's, as I was putting this together, I looked up any sort of websites that could give you an idea of what those sound like. And I found vetvisions.com. They weren't very loud because I was going to play a couple of them, but they did have representations of things that you would commonly hear. Like a sinus arrhythmia in a dog is considered normal. And you can hear that, and then when you hear it on the patient, you'll be able to connect that as normal. They also had examples of murmurs too. And you don't necessarily have to know what it's being caused by, but if you hear what you think is a murmur, that would be a good case of this dog needs further evaluation. And when we put the stethoscope on the chest to assess heart rate and heart quality, the quality of sounds, we're really trying to assess the valves that are closing, the aortic valve, the pulmonic valve, the mitral valve, and the tricuspid valve. So on the left side, we can hit 3 of those valves. On the right side, we can hit 1 of those valves. And also to try to assess lungs by using your stethoscope as well. Here we're just trying to see if it's different than usual. Are sounds decreased or absent? Are they increased or abnormal? Is there any increased respiratory effort that the animal's making? Is it a struggle to breathe for them? And here's just a diagram of where we're going to place the stethoscope in order to listen to lungs. Okay, so we're moving on to abdomen. We're going to palpate for any hernias. And our options here are umbilical hernia or inguinal hernia. And really important for this to be assessed at intake, because that animal, if he has a large umbilical hernia, that may be a situation that needs immediate attention. Things can drop through that umbilical hernia, get twisted, and cause a problem for them. But if during spay and neuter, if you are able to fix those, that would be a nice heads up for the team who's doing the spays and neuters, that an umbilical hernia or an inguinal hernia was found upon intake, for the vet to assess it and see if they want to fix it during spay and neuter. Also, we want to see if they have any tumors. Is this animal pregnant? And gently palpate the abdomen for any abdominal masses, obvious masses, or when you palpate the animal, does it cause pain for them? The hind end, we've already looked at sexual status, so here we're going to focus on other things that are located on the hind end, the anus. Is there evidence of diarrhea? Is there discharge from the anal sacs that might mean that the anal sacs are infected? Are there tumors? Is there a prolapsed rectum? And the most times I've seen prolapsed rectums are in kittens who are straining to poop, and they strain so much that they ultimately get a prolapsed rectum. And our musculoskeletal system, looking at the animal from a distance, are there any gait abnormalities? Are they obviously lame? Actually take your hand, run it down their vertebral column and their limbs to see if the animal yipes. Are they painful? Is there any swelling, any overt evidence of fractures, muscle atrophy, or decreased range of motion? And skin, nice picture of skin. And that allows us to assess partially the animal's hydration status. You can lift up on the skin at the shoulder blades. If it snaps back down nicely, probably an animal that's well hydrated. If it's sluggish, probably an animal that has some level of dehydration. We also want to see if they have any hair loss, external parasites that we can see, fleas, tumors, abscess formations, scabs, lacerations, or overgrown or embedded nails. Okay, so that concludes our overview of the physical examination. But now we have all this information, what do we do with the findings? And obviously we're going to put it in the animal's medical record. We're going to try to speed reclaim of that animal. Anything that we can do to lessen the animal's length of stay with us, we want to use that information to do so. We want to schedule necessary services, and that might be this animal has a non-emergency medical condition that does need to be looked at by a vet, but that could be scheduled tomorrow. It's not an emergency, we don't have to rush them over immediately. And also things like grooming. We want to develop a list of animals who need an exam, diagnosis, and treatment by the vet. And we want to use that information to monitor for any changes over the course of the animal's stay. And really important, shelters have increased their capacity to treat a lot of animals, to perform dentistries, to do leg amputations if necessary, to repair fractures. But some things shelters aren't in a position to address. And at least we can use that information to communicate any of these challenges to potential adopters, so that when they take that animal to their vet, they're armed with that information. It's not a big news flash when they show up to their veterinarian that this animal's going to need a dentistry. They already learned that, and they've taken that into consideration when they adopted the animal. Or if this is an emergency condition, to obtain immediate care as necessary. And very importantly, place the animal in an appropriate location within the shelter. That might mean healthy stray hold, might mean quarantine, isolation, or perhaps that's an animal that can go right up for adoption and hopefully leave soon. So we're going to spend some time looking at emergencies. During our physical examination, we want to be able to identify what's normal, what's abnormal, and this is another category of emergencies. This really needs to be attended to quickly. If an animal has a fever of 105 Fahrenheit or temperature below 99, those really are emergencies. Those animals have something going on that needs to be addressed. Severe dehydration, any trouble breathing, particularly in cats, any open mouth breathing, that's an indication that they're really struggling. Any seizures or very blue or pale or brick red gums, an animal that's emaciated, they're going to need a plan for refeeding that's directed by the veterinarian. Any recent history of being hit by a car, acute or severe lameness or injury with bone exposed, that needs to be addressed and started on antibiotics. Any major wounds, fresh wounds requiring sutures. Eye conditions, any injuries to the eye. Eye conditions also tend to be painful if they have an enlarged globe. So basically, anything abnormal with the eye is considered an emergency. Bleeding or easily extensive bruising, suddenly swollen abdomen, and I'm sure you guys all know this, a cat who's possibly has urinary blockage, those guys can die pretty quickly. And they're fairly easy to determine. If you get good at palpating the abdomen of cats to realize what their bladder should feel like, then you can easily determine when the cat has a baseball-sized and it's hard, their abdomen, because they can't pee. And they haven't been able to pee for a while, couple of hours, couple of days. So also pregnant animals in distress, that's an emergency. Whether this animal has evidence of pain, and a lot of times they would be restless, vocalizing, panting, failure to bear weight on any limbs, all of those things, emergency situations. So another category that you want to be aware of is infectious disease red flags. And here we immediately want to wear personal protective equipment so that we can prevent spreading disease to other animals. And that simply if they have bloody or severe diarrhea, if they're vomiting or have diarrhea with any other signs of disease, If they have neurologic signs, always have to consider the possibility of rabies. Oral ulcers with fever or swelling, especially in cats. Discharge from the eyes or nose, circular patches of hair loss, which may be indicative of ringworm. Or if we find an animal who's dead in their cage, highly suspect for parvovirus or panleukopenia, to run those tests to see how we need to handle that animal's dead body to trace them back to see where they've been within our shelter. So really important, don't reinvent the wheel here. There's lots of resources that you can use to train staff and also to perfect the system within your own shelter. And here's a nice form, a health check form from Correct Shelter Medicine Program from their website that you can use as a checklist when these animals come in. So it has all these body systems listed, whether or not you've seen any parasites, any sort of abnormalities you can identify on the checklist. And that's a nice way, again, for accuracy and consistency within your system. Also, ASPCA Pro has a nice supply list for intake rooms so that you can have all of your items gathered in one place and you make it easier on yourself and the patients. And they also have a nice step-by-step slideshow that shows a veterinarian performing an intake exam, and that might be useful for training purposes too. Okay, so one more opportunity for your feedback. When I go to presentations, oftentimes I'm all excited and I think to myself, well, how am I going to implement this in the real world? And sometimes that's where the big challenge lies, is taking all this information and making it work for your shelter. So in regards to performing physical examination, especially at the time of intake, what are your challenges? What have you found to be difficult to make that happen? Not enough staff. Yep, good one. Gotcha. So, staffing issue, not having enough staff, and also not having the right staff member, the right type of staff member, a vet who can deal with those problems on an emergency basis, that your shelter has to wait for those people to come to you, or some shelters to make appointments for the animal to go to them. So we're going to address some of those, but the one thing that I hadn't thought of was the shelters who have animal intake, who perform exams at intake and then have to go back and tell the person who's surrendering that animal bad news. So does your shelter have any, and part of this exercise is that we identify the challenges, but we also share solutions. So if anybody has any ideas for solutions to those items that have been brought up, please feel free to share. So a lot of times when we, and this doesn't come as big news to anybody, but when we identify challenges, it gives us an idea of, we're seeing a lot of these patients, we're seeing a lot of these animals come in with similar problems. It helps to provide impetus and data for us to realize which programs need to be developed. And in a lot of cases where people see animals whose owners don't have the resources to provide medical care, then they start thinking about developing a community-based programs, relationships with veterinarians who will help those animals in those circumstances. And a lot of times that resonates with donors. If you can find people and present them the data to say, this is what we're dealing with, can you help us with that? And building relationships with veterinarians, super important. ASV is going to have a webinar in conjunction with HSUS about establishing relationships between shelters and veterinarians in December. And in different communities that plays out differently, but at least to try to make that happen. So the couple of things that I came up with and were also resonated in the audience were understaffed. Animals might wait days for an intake exam to be done. And here, just really the importance of we're spending 15 minutes per animal. We either spend it today when that animal comes in, or we spend it 3 days from now. The time that you spend is the same. But a lot of people say, well, I can't catch up. I need to be able to catch up to a point where I can start doing the exams upon intake. And some shelters have hired temporary staff in order to do that. Some shelters say, this is another one, animals come in at all different times of the day. Staff members have multiple duties. We can't keep pulling them away from their multiple duties in order to perform that examination. And in that case, you might set aside a chunk of time towards the afternoon, towards the end of the day, where you can look back historically and say, this is the amount of animals that we expect to come in during this month, and set aside that amount of time, and then know that that staff member's time is going to be occupied doing exams. That's what their role is at that part of the day. They do all the animal exams. They clean and disinfect that area for the appropriate number of animals that they know are coming in tomorrow. So those are just a couple of different ways to manage that. So other things that I thought of and was reiterated, we do not have a veterinarian on staff. How can animals receive the medical care that they need? And that's really common for shelters, unfortunately. And that's the importance of generating lists that show which animals need medical attention, but which animals need it on an emergency basis, and establishing those relationships within your community to provide that care. If you have 1 or 2 hospitals that you know you can call upon when you have an animal in emergency, establish those relationships proactively so that you can take the animal there and receive the care that they need, as opposed to scrambling when you see that animal coming in. What about animals that our animal control officers bring into the shelter overnight or when the shelter is closed? And our next slide is going to sum things up. Basically, everything within a shelter becomes dependent upon having standard operating procedures written by, devised by your staff members, organized and approved by management, so that you have a plan for a lot of the things that you're seeing on a regular basis. Train your staff towards those SOPs, and also really important for shelters is building those external relationships with veterinarians, with other people, with donors, so that you can have the resources to provide necessary care. And that's obviously going to equal success in everything that we do. And I wanted to thank Stephanie Ginesco for providing some of the information for this presentation. And I know we didn't answer everybody's questions as thoroughly as you would like, but I'm available to answer more questions now or in between the break, and hopefully we can come to some solutions for you. Thanks.